Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, all the problems in elderly needs more attention than younger persons. So, to discuss on this, we are being joined today by Dr. Bhavani Prasad Chakravarty, Medical Director from Health City Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Dr. Bhavani Chakravarty, for joining to Good Life, the health show today. And today, the topic which we have taken is actually important and sometimes we neglect it. So, if we need to know about the common health problems in elderly, what are the basic health problems? What would you like to tell our viewers?
You see, elderly, there is two things. One is the healthy aging, and the other thing, the diseases.
Okay.
Now, with advanced age, our body slowly slows down, our immunity slows down, and certain parts of the bodies, for example, heart, lung, brain, blood vessels, they are no more in their prime.
Okay.
So, we have certain problems. Of course, we have more incidence of heart diseases. We have strokes. We have lung diseases like, say, asthma, COPD. More important that is that cancer.
Okay.
Cancer, of course, increases with age.
Okay.
So, all kinds of cancer may be more.
Achha. All kinds of cancer.
All kinds of cancer. Along with that, with this, your problems of joints, problems of bones, your gait, your hearing, your vision,
Right.
everything comes up.
Now, if we talk about, when we are talking about elderly people, of course, they need a lot of attention.
Yeah.
So, if we talk about the difference in health problems between younger and older persons, what would be that?
See, diseases are the same, but the problem is the presentation, because the elderly people usually don't have only one disease. For example, if a person comes to me with fever, I cannot just look at him as a patient with fever, because he may have associated high blood pressure, he may have associated heart disease, he may have associated lung disease, he may have associated prostatic enlargement.
Okay.
So, when I assess him and diagnose him, I have to look into these associated diseases, which is not usually present in the younger persons. And while treating also, while prescribing those medicines, I have to see that the medicines which I will prescribe to him will not harm his body.
Okay. So, things have to be taken care of when we are talking about elderly people, rather younger generations. Now, doctor, there are a lot of factors. We will be touching upon that. Now, if we talk about how health problems are to be addressed in elderly, we have to be very careful when we need to diagnose something. First of all, we have to know about the psychological problems as well,
Yes,
because
very
we have, when we are talking about elderly people, we are just thinking that we are handling a child, isn't it? So, if we know, if we have to assess or we have to address the problems in elderly, how to do that?
First is that you have to be very careful. You have to have a good knowledge about the problems of the elderly. The doctor must have.
Okay.
Not only doctors, but all the health professionals attached to them, for example, nurses and others. And first, while taking the history and examining the patient, you have to take care of the age and the related disorders. And while examining him or while investigating him, you should not bother him too much.
Okay.
And as you have said, that he must be having associated anxiety, depression, and maybe also dementia. So, he may forget certain things to tell.
Right.
So, if you are lucky that if he has a good attendant who can supplement his symptoms with patient symptoms, then it's better. But if not, then you have to be very careful about extracting the history.
Okay.
Examine him. And as I've told you earlier, that he might be having not one disease. There are certain other
Multiple
diseases.
disease.
And he might be having a lot of tablets together. So, all these things are to be noted. Then take the history, examine the patient, make a diagnosis, and while treating the patient, you have to be extremely careful about not to over-treat him.
Okay, okay.
And not so that the medicines do not interact. So, this is it. And another thing you have to remember, that a disease in a young patient may show more severely in elderly.
Okay. Okay.
Say example, a person comes with young persons with say chest infection, you may investigate and treat. But in elderly, you know that the infection may spread very fast.
Very fast.
And it may go to blood also. So while treating the patient, you have to be careful so that you can treat it early so that you can control the disease on time.
So a lot of challenges lies ahead when you are treating an elderly people. All right, doctor, we will proceed with the conversation. We have a caller at this point in time. Let's take the call. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মই আপোনাৰ কথা জানিব বিচাৰিছিলো বৰ্তমান মোৰ গ্ৰেণ্ডমাদাৰ অৰ্থাৎ এটা প্ৰব্লেম হৈ আছিলে আপোনাৰ পৰা তেওঁ ধৰক মেডিচিন বহুতখিনি ডিপাৰ্টমেণ্টত এনেকুৱাকৈ দেখুওৱা গ'ল তেওঁ কথাবিলাক বহুত ধৰণৰ এতিয়া ধৰক বয়সৰ ওপৰতো হয় বুলি কয় মানুহে কথাবিলাক পাহৰি যায় কোৱাৰ কথাটোকে বাৰে বাৰে ৰিপিট কৰি দিয়ে তো তেনেকৈ তেওঁৰ মানে মেণ্টেলি লগতে ফিজিকেলিও বহুতখিনি কষ্ট পোৱাৰ নিচিনা হৈ আছে তো এতিয়া কেনেকুৱা ধৰণৰ খোৱা লোৱাৰ ক্ষেত্ৰতে মই জানিব বিচাৰিছিলোঁ কি হয় যতন ল'লে কি হ'ব সেইটো বিষয়ে কেনেকুৱা ধৰণৰ খাদ্য খুৱাব লাগে সেইটো বিষয়ে অলপ জানিব বিচাৰিছোঁ
চাওক এইটো বয়সত পাহৰি যোৱাটো স্বাভাৱিক সকলো মানুহে বয়সৰ পিছত পাহৰে কিন্তু যেতিয়া এতিয়া বেছিকৈ পাহৰে যেতিয়া ধৰক 5 মিনিট আগত খোৱা বস্তু যেতিয়া পাহৰি যায় দুপৰীয়া ভাত খালে নাই পাহৰি যায় পানী খালে নাই পাহৰি যায় সেই কথাবিলাক অলপ সাৱধান হ'ব লাগিব তাৰ কাৰণে তেওঁৰ প্ৰতি তেওঁৰ ল'ৰা ছোৱালীয়ে হওক বা ঘৰত থকা মানুহ কোনোবাই চাই থাকিব লাগিব আৰু নিউট্ৰিশ্যন খোৱাটো যিটো কৈছে আপুনি সহজতে হজম হোৱা বস্তু কোনো গুৰুপাক বস্তু দিব নালাগে ইজিলি ডাইজেষ্টেবল বস্তু দিব লাগে সাফিচিয়েণ্ট পানী খাইছে নাই চাব লাগিব তেওঁৰ যিখিনি ব্ৰেকফাষ্ট লাঞ্চ ডিনাৰ যি দিয়ে সেয়া সুষম আৰু বেলেঞ্চড হ'ব লাগিব তাত কাৰ্বহাইড্ৰেট প্ৰটিন ফাইবাৰ সব থাকিব লাগিব গতিকে অন্য সাধাৰণ যে কিবা বেছিকৈ কিবা দিব লাগিব স্পেচিয়েল ফুড দিব লাগিব সেইটো নহয় নৰ্মেল যিটো ফুড সবে খায় তাকে দিব লাগিব যাতে সহজতে হজম হয় সেইটো ফালে চাব লাগিব
All right. Thank you so much for calling at this point in time. And viewers, our numbers are flashed on your television screens. So if you have any queries regarding the topic which we are discussing at this point in time, and with me is right now Dr. Bhavani Prasad Chakravarty, Medical Director from Health City Hospital. So please call up and ask your questions, and I'm sure you will be getting your valuable answer as well. All right, Doctor, we were talking about how to address the problems in elderly, and one has to be very careful because once you ask someone who is elderly that we will be taking you to a doctor. So a lot of questions arise in their mind that what had happened to me. So at that point in time, as if you are treating a children, you have to treat an elderly very carefully. Now, talking about the role of vaccination in elderly. Is there any role of vaccination in elderly as well,
Nowadays,
doctor?
vaccination is a very big thing. Just like children, we must vaccinate the elderly because certain diseases can be prevented. For example, as in children you give tetanus injections, in elderly also you should give tetanus injections.
Okay.
And two other, for example, hepatitis B vaccine. If he's not vaccinated, he has to be vaccinated. More importantly is that vaccination against influenza and pneumonia.
Influenza and pneumonia.
Because influenza can be fatal to the elderly. So you have to give influenza vaccines every year just before set of winter, preferably.
Okay.
And every, influenza virus changes its character time to time. So you have to be careful about that so that you give the latest influenza vaccine. So
All right, doctor, we'll come to that. We have another caller at this point in time. We will come and discuss on this as well. All right, hello. Hello. আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
মোৰ মানে প্ৰব্লেম এটা আছিলে মানে মাজতে মই ষ্টেনডাল লগাইছিলোঁ হেল্ল'
আমি শুনি আছো কৈ থাকক
ষ্টেনডাল মানে লগোৱা আপোনাৰ 1 বছৰ মানে হ'ল ইউৰোলজি হয় আপোনাৰ মানে এই মোৰ কিডনী ষ্ট'ন আছিলে
কিডনী ষ্ট'ন অ'কে
হয় তাৰপিছত মানে মই এতিয়ালৈকে উলিয়াব পৰা নাই মানে কিবা প্ৰব্লেম হ'ব নেকি এনে
আপোনাৰ কিডনী ষ্ট'ন আছে
হয়
স্যাৰ কিডনী ষ্ট'ন নানা ধৰণৰ থাকে কিছুমান ষ্ট'ন আপুনি বৰ বিশেষ চিন্তা কৰিব নালাগে কিন্তু ষ্ট'নটো যেতিয়া ডাঙৰ হয় বা নামি আহে কিডনীৰ পিছতে ইউৰেটাৰৰ পিছত ব্লাডাৰ এইবিলাকত যদি নামি আহে তেতিয়া আপুনি সাৱধান হ'ব লাগিব আৰু চিকিৎসা কৰিব লাগিব
হয়
কেতিয়াবা কেতিয়াবা দৰৱৰ দ্বাৰাই ওলাই আহে আৰু কেতিয়াবা ওলাই নাহিলে আপুনি ইউৰোলজিষ্টক দেখুৱাব লাগিব আৰু তেওঁ সেই সুবিধা মতে আপোনাক বিনা অস্ত্ৰোপচাৰে হয়তো আপুনি পাৰ ইউৰেথ্ৰাল মানে পেচাবৰ নলীৰেও ওলাই আহিব পাৰে আৰু নহ'লে খুব ডাঙৰ হ'লে যদি ডাঙৰ হৈ যদি নামি নাহে তেতিয়া হয়তো তেনেকৈ অস্ত্ৰোপচাৰ কৰিব লগা হ'ব পাৰে এই গোটেইখিনি বস্তু আপুনি এজন ইউৰোলজিষ্টৰ লগত কনচাল্ট কৰিব তেওঁ আপোনাক এই দিব উপায় দিব
All right, all right. He has a kidney stone, and he was also talking about that he has put up a stem which has
Stent, yeah.
Stent. Okay.
Yeah.
So when is the right time to take out that stent, doctor? Is there, of course, a urologist will be a preferable way to-
actually depends on what stage this disease is now how where is the stone how
Okay.
much is the obstruction
Okay.
and then if there is an infection so
right.
many factors are there
Okay, doctor,
I think-
we
yeah.
have another caller
Yeah.
waiting. Hello.
হয় কওক
Hello.
হয় কওকচোন
আমি শুনি আছো আপোনাৰ কিবা প্ৰশ্ন থাকিলে সুধিব
হয় মই কওক ঠিক আছে
হেল্ল' আপোনাৰ টিভিৰ ভলিউমটো অকমান কমাই ল'ব তেতিয়া প্ৰশ্ন সুধিব সুবিধা
কমাই আছো মেডাম মই কমাইছো
শুনি আছে ডক্টৰ শুনি আছে
ছাৰৰ কথা এটা পাতিব খুজিছো
শুনি আছে তেওঁ আপুনি প্ৰশ্নটো কৰক
মই আজি ছাৰৰ টিভি দেখা পাই খুবেই ভাল হৈছে ছাৰৰ তাতে মোৰ ট্ৰিটমেণ্ট কিছুমান চলি আছিলে হেল্ল' ছাৰ
হয় কওক
আচ্ছা মোৰ তাৰমানে আজি এবছৰ আগতে আপোনাৰ তাত দেখুওৱা হৈছিল মোৰ অলপ মানে লিভাৰৰ প্ৰব্লেম আছিল এতিয়া কথাটো হ'ল কি মই অলপ বস্তু খালে পেটটো অলপ গধুৰ লাগে মই অহাকালি আপোনাৰ তাতে যাম বুলিয়ে ভাবিছিলোঁ মই এতিয়া মোৰ পেটটো অলপ কিবা খালে অলপ পেটটো গধুৰ লাগে আৰু ভোকটো বহুত কম হয় আৰু মুখত ৰাতিপুৱা হ'লে অলপ লেলাউটি মোৰ জমা হৈ থাকে
ঠিক আছে আপুনি যদি আহিব খুজিছে আহিব আপোনাক কি কাৰণে হৈছে আমি প্ৰথমতে আপোনাক পৰীক্ষা কৰি আপোনাক আপোনাৰ হিষ্ট্ৰীটো লৈ আপোনাক পৰীক্ষা কৰি কাৰণটো উলিয়াব লাগিব আৰু কাৰণ কি ভোক নলগা আৰু পেটটো ফুলি থকাৰ কেইবাটাও কাৰণ হ'ব পাৰে আৰু যদি আপোনাৰ তেনেকুৱা হৈ আছে আপুনি আহিব আমি কাৰণটো উলিয়াই আপোনাক হয়তো কেতিয়াবা একো বিশেষ কাৰণ নাথাকে আপোনাৰ খোৱাটো হজম নহ'ব পাৰে আৰু প্ৰয়োজন হ'লে আপোনাক দৰৱ পাতি দিয়া যাব
মই গোটেইখিনি পৰীক্ষা কৰিছোঁ ছাৰ
ঠিক আছে আপুনি লৈ আহিব ৰিপৰ্টখিনি আপুনি লৈ আহিব মোৰ তালৈ মই চাই
হয় ঠিক আছে
All right. Thank you so much for calling at this point in time. All right, doctor, we will proceed with the conversation, but right now we have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching Good Life, the health show with me, Puja, and we are having a fruitful discussion on the various problems in elderly. Well, doctor, coming back to you again, we had an incomplete conversation on the vaccination for elderly. We would like to know about that more.
Yeah, as I've said, your vaccination, two things are very important for all the elderly. Is the vaccination against pneumonia and vaccination against influenza. Because these diseases can be deadly with elderly people and we may lose them. So it is utterly preventable. So if you give influenza vaccine every year, just at the advent or just before the winter, I think that protects them. And only thing is that this the profile of the influenza bacteria changes very fast. So you have to be very careful that you are giving the latest vaccine.
Okay, latest vaccine. Now, how to convince the elderly ones? Because
you have to tell them that these two diseases are preventable. If you don't take these shots, then you may have influenza. You may have just like COVID. It's preventable disease. So if you take the shots of influenza, you will not suffer. And second thing, pneumonia. Here's what is called pneumococcal pneumonia. It's a quite common disease. And it is also prevalent in the society. Suppose the elderly man goes to the market, so he may acquire that. And if in younger person, it's very simple disease. You may have to give antibiotic and within few days he's all right. But in elderly, it may...
Their body has to take that actually because it depends.
It spreads so fast that it may kill him. Pneumonia may kill him or her. So if you take pneumonia vaccine, every 4 to 5 years interval, then you are safe not to acquire pneumonia.
All right. Now, is there any precaution that has to be taken before giving these vaccines to the
Nothing.
elderly ones? Suppose when we talk about elderly, they of course take some high pressure pills or diabetes pills or some
problem.
other
They can
ailment
just
pills as well.
continue their normal diabetes pills.
Okay.
They can just take, and especially in case those persons are suffering from diabetes and high pressure and other diseases, they are more prone to develop these diseases.
Okay.
So, in fact, they should take it more. They should be more careful about not to miss it.
All right. Now, of course, attention has to be given more than younger people to the elderly ones, whatever we are talking about, be it any ailment or something. Now, there are some common problems, that is the eyesight problem. We talk about hearing. Now, cancer, joint pains, if we keep it aside, but for eyesight problems and for hearing problems, and these are very basic
These are
problems.
very, very important also.
Okay.
Because you see, the two
That leads to some other ailments as well.
See, if a person, this problem of cataract is very common.
Okay.
And problem of glaucoma is also not uncommon.
Okay.
So, you don't treat cataract on time. If you don't treat glaucoma on time, the person will lose his vision. And losing vision is more dangerous.
Right.
He'll be all alone, he'll be needing help.
Okay.
So, eye checkups are very important. Nowadays, lots of eye hospitals are there, lots of government centers are there, and it is the duty of the, I request the NGOs also, students, NGOs, your elderly person, children, they should inquire about the eyesight and at least get some checkup, because these are all preventable. Cataract surgery done, his vision is clear. Glaucoma treatment is taken on time.
Okay.
Then also the patient can be saved from the complications.
Right.
Similarly, hearing. If the hearing is, normal hearing loss will be there with the age. But if the hearing loss is going down, then it becomes a big problem for him, because he cannot go outside, he cannot hear, he cannot see. So, there will be more problems.
More
He may
problems
fall
that
down.
leads to psychological problems
Yes,
as well.
and he will be dependent on the others.
Absolutely.
So, I think I urge the population so that they take care of the elderly and they take their parents or grandparents to the hospitals for
Okay.
check-up of these two conditions.
All right, all right. There are a lot of things that has to be taken care of, as we, a younger generation, has to take care of our elderly people as well. And there are a lot of awareness campaigns also nowadays held by the hospital authorities, also by some of the NGOs, as you have mentioned. Now, Doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello.
Hello. Ami shuni asu. Apnar prashno to koribo.
More kidney disease disease.
Ki kole?
More kidney disease disease.
Kidney pisfale?
Cheese.
Hello.
Hello.
Apnar prashno to aru ekbar koribo. Ki koi asile?
More kidney disease ase bhi koisil.
Okay.
Hello.
Or kidney cyst.
Ha.
Kidney cyst আপোনাৰ বেছিভাগ সময়তে ডেঞ্জাৰাছ নহয়। সাধাৰণ cyst যিবোৰ চিম্পল cyst থাকে সেইবোৰ বিশেষ ট্ৰিটমেণ্টৰ দৰকাৰ নহয়। কিন্তু যদি cyst বহুত থাকে আৰু cyst বিলাক যদি ডাঙৰ হৈ গৈ থাকে তেতিয়া হয়তো আপোনাক চিকিৎসাৰ দৰকাৰ হ'ব।
আৰু কিবা খুদিব বিচাৰিছে যদি খুদিব পাৰে?
হ'ব।
All right. Thank you so much for calling. Well, viewers, there are still numbers flashed on your television screen. So if you need to ask any queries regarding whatever topic you want to ask, please call up and ask your question. And a doctor is with us to give you all the valuable answer. Now, doctor, coming back to the basic problems we just already touched upon, the eyesight, also the hearing problem. Now, if we talk about the heart problems and the lung problems in elderly, that also can't be exempted. That also can't be
very
avoided.
important.
Very important.
Very important.
Now, what do you suggest to the attendants or the family members that a regular checkup is must
It's
for
a
the
must.
elderly ones, whoever is at home?
See, with age, your heart also ages.
Okay.
Your blood, the vessels which supply the heart, which are called coronary arteries, narrowing is there. So the heart pumping function is also less.
Okay.
And added to that, if you have hypertension, if you have high pressure, then heart is also pressurized, heart has to pump forcefully more.
Right.
So, and with that, if you have diabetes, then all these problems, your progresses further very fast. So, a person, any elderly, we should be careful and we should check his blood pressure regularly. We should check his heart regularly, and we should see that he is not suffering from diabetes. If we can take care of these things, if we can take care of the high pressure and diabetes properly, then the progression of the heart problem will be less.
Okay.
And if the person already is having heart disease, then depending on the cause, depending on the, if for example, if a person is suffering from coronary artery disease, how much? If it is more, then you have to do certain investigations.
Okay.
Maybe medicines will work, or maybe you have to do angioplasty. In very severe cases, maybe you have to do CABG or operations. So, this depends on the stages of the disease. But first thing that you have to assess, you have to show it to the doctor.
Right.
And then according to the stage of the disease, you have to treat
Start
either
the
medically
medication.
or surgically, whatever is needed.
All right. Now, doctor, a diet and a balanced diet is also very important
Very
for an elderly person, isn't it? Now, if we talk about the diet, small meals are recommended.
Yes.
And what are the things can be included in the balanced diet?
See, actually, it's just like any other person. Only that it should be seen that the patient likes the food, taste should be to his tongue.
Okay.
And it should be easily digestible. Nothing like that. For example, the restrictions will be there if the person is having high pressure, then salt should be restricted.
Diabetes, then.
Diabetes, then sugar has to be restricted. And otherwise, I don't think whatever he can digest, he can take, it should be digestible. And vitamin supplements can be given if the doctor feels that he needs the vitamin supplements.
Okay.
It can be given.
And a very happy environment is also
Yes,
very
yes,
important.
yes, very
An
important.
environment that will lead to a happy life and also a good life for the elderly people, not only for the elderly people, for the entire family as well. Now, doctor, if we talk about the other problems, that is the prostate or the other things, like prostate is also commonly seen
Very
in
common.
male
Males,
elderly
yeah.
people. Now, on that note, proper investigation is very important, and then the treatment can be started up. Is all prostate problems does need a surgery or something like that?
Not necessarily. Nowadays, see, prostatic enlargement, it can be benign
Okay.
or it can be malignant.
Okay.
Because malignant or the cancer of the prostate is a very silent killer. So, every elderly man should be properly investigated for any prostatic problem.
Okay.
For that, we can do simple investigations like ultrasound and some other tests and some blood tests. And if we find that the patient is suffering from prostatic cancer, it can be treated in the early stage, then patient will be all right.
Okay.
And benign prostatic enlargement, there are numbers of medicines which the urologist will apply or supply, and patient will be all right. Because as you know that as it is a silent disease, most of the patients, they come very late, already spread to the other parts of the body.
Okay.
So that it doesn't happen. So it's a protocol in a male patient who comes, an elderly patient comes, it has to be, prostate has to be examined or you can say investigated.
Investigate. All right, doctor, we have a caller at this point in time. Hello? Hello? Hello?
Yes. Hello.
আমি শুনি আছো। Hello?
এই মানে এটা 2 mm cyst ওলাইছে cyst
Cyst.
Kidney. 2 mm cyst kidney.
হয় লেফট টুত ওলাইছে
একো নহয়।
সেটো কিবা অসুবিধা হ'ব
একো অসুবিধা নহয়, আপুনি চাব কিবা যদি অসুবিধা জনাব লাগিব আপোনাৰ ফালৰ পৰা, আৰু নহলে সময় কিছু ধৰক বছৰত এবাৰ দুবাৰ চেক কৰিব, যদি সিস্টটো বহুত ডাঙৰ হৈ যায় তেতিয়াহে প্ৰব্লেম হ'ব, এনে একো প্ৰব্লেম নহয়।
হয় তাৰ এনে এইটো কি পৰীক্ষা কৰিব লাগিব এনে মোৰ এইটো হেৰি এইটো সিটি স্ক্যানত ওলাইছিলে
আপুনি ডাক্তৰক দেখুৱাব, এইটো আল্ট্ৰাসাউণ্ড কৰিলে হ'ব চাগে, দৰকাৰ হ'লে ডাক্তৰ সিটি স্ক্যান কৰাব, বাৰে বাৰে সিটি স্ক্যান কৰাব নালাগে।
এনে মোৰ ডায়াবেটিছও আছিলে, কিবা অসুবিধা হ'ব নেকি?
নহয় একো অসুবিধা, ডায়াবেটিছটো আপুনি কণ্ট্ৰল কৰি থাকক ভালকে।
হয় হয় আৰু অনুষ্ঠান নমস্কাৰ, হেৰি ইউৰলজি প্ৰব্লেম এটাও হৈছে মোৰ। ইউৰলজি প্ৰব্লেম।
ইউৰলজি প্ৰব্লেম কি, পেচাবটো ভালকে ক্লিয়াৰ নহয় নেকি, নে ৰাতি বাৰে বাৰে উঠিব লাগে?
হয় হয় ৰাতি মানে ফ্ৰীকে প্ৰস্ৰাৱটো নহয়।
হয়তো আপোনাৰ প্ৰষ্টেটিক এনলাৰ্জমেণ্ট হোৱা যেন লাগিছে মোৰ, আপুনি ইউৰলজিষ্ট এজনক দেখুৱাওক আৰু প্ৰয়োজন মতে যি দৰৱ দিয়ে আপুনি দৰৱ জাতি খাওক।
All right. Thank you so much for calling at this point in time. And Doctor, we are really short of time, so this will be the last caller of the day. Now, we have mostly touched upon the basic and the important problems of elderly. Now, on last note, what would you like to tell our viewers who are watching our show at this point in time? What would you like to give them your valuable suggestion?
All the elderly person, my request is that take care of your health. Don't smoke. Try to lead a happy life and we cannot treat old age. We have to promote it,
Okay.
we have to protect it and extend it. These are my last words.
All right. Thank you so much. Those were the wonderful lines and wonderful suggestions by a doctor. And we had a fruitful discussion at this point in time. Thank you so much, Doctor, for
Thank
joining
you.
to Good
Thank
Life,
you
the
for
Health Show
calling
today.
me.
All right, viewers, with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.